The first topic I want to talk about is a very common topic in primary care and in general lives is chronic tension headaches. So tension headaches are so high in prevalence. There's a really good possibility that you yourself would have suffered from one at some point in your life. The prevalence, depending on your age group, could be as high as up to 80%, and it seems to be more common in the young to middle age, but there's a prevalence like up to 80% of the adults have suffered from tension headaches at some point. So it's a really, really common thing. There could be something that's infrequent, there could be something that's persistent and becoming a chronic tension headache type. So, depending on whether you're getting it frequently or you get it once in a while, no big deal. You can take an ibuprofen and it gets better, and you take rest and it gets better. But if you're getting them frequently, and it's more of an issue because then you're having to take more of rescue medications, and sometimes they don't work all that well. So the tension headaches can get to a point where you have, so many headache days a month that it really affects your quality of life, your performance at work, and also there's this overlap with migraine syndrome. A lot of people with tension headaches often have some features of migraine and some features of tension headache, and that's not uncommon at all. And the triggers can also overlap. So things like sleep schedule and food triggers, they could be an overlap. Exhaustion, those things could just overlap between the two. So what are tension headaches? So how do we diagnose them? Your doctor really diagnoses it clinically when you go in and give your history. So it's based on certain criteria. Most of the time, we know them as tension headaches affecting the back of your head and associated with the tightness of the muscles. And that used to be one of the diagnostic criteria, which it no longer is, but it's very common still to find that as part of the history with the tight muscles around the neck. And it is typically much worse with stress. And sometimes people find that association and sometimes they don't. It's much better if you have a headache journal to kind of see that pattern. And there are other things though that can manifest like tension headaches, which you have to make sure it's not before you go down the path of treating or managing tension headaches. Like this could be high blood pressure that's not treated, it could be sinus infections, or it could be an issue with your vision, some refractive errors. It could be any of those things. It could also be occipital neuralgia, which is a headache coming from your neck, and actually that can be very tricky. It can be very similar. So there are other things that have to be sort of ruled out based on how your history is before you go down the path of treating tension headaches. So why do some people get tension headaches more than others? And it's really, really severe in about 2% of the cases. Although like I was saying, 86% of the adults have had tension headaches at some point, but it's really severe in some people. There could be some genetic factors which is making it more severe. There could be environmental factors too. And some of the pathways that we know exist for chronic pain syndromes similarly exist for tension headaches, where your body is more sensitive to certain stimuli, certain things, and trigger points are present in your neck. That could be there, and your pain threshold is lowered for some reason. There's problems with your posture, the way you hold your head. It's a little stooping posture. There could be a little less range of motion of the neck that could be associated. There's also some kind of inflammatory association. There are some inflammatory chemicals in some patients we've identified, like interleukin 1B, which points out towards some inflammation. Interestingly, neurovascular inflammation, which means that it would respond to certain things in the diet that reduce inflammation. So those things could contribute. So there are many things that could contribute, and there could be some receptors around the blood vessels and tendons that are getting triggered, and they call the nociceptors. So all these things could contribute to why you're getting the tension headaches. And of course, stress plays a role, but why some people with stress more than others? And everyone responds to stress differently. Some people get tension headaches, some people get irritable bowel. Everyone's bodies are different. So it's one of the stress-related problems for sure. And it's definitely good to keep a good journal to see the pattern. And sometimes your body misinterprets pain when it's not supposed to interpret pain, and that could be part of the issue. And there's also an increased excitability of your nervous system, and that changes the tension headaches from being episodic, which means once in a while, to chronic tension type of headache. So that could change too. And what do we currently do for the tension headaches? I mean, when the tension headaches come on, people try to take rest. They try to take some ibuprofen or relief, that's non-steroidals. There are things to prevent tension headaches, that if you're getting so many headache days a month, they're really taking a toll on your quality of life. So often we prescribed antidepressants to help prevent these headaches. And some people don't tolerate them well or don't respond to them well, which is why we're going to talk about alternative options to prevent them in the first place and even manage them better, which we'll talk in the next video.